I am C.E. Gopinathan, worked in Delhi in one of the leading public sector consulting organizations during the period from 1982 to 2007. In 2003, I was suffering. I knew I had problems with prostate, and that was after an ultrasound by the company's doctor. It was proved. They suggested an immediate surgery, TURP. But actually, since my children were college going and they were busy, I couldn't devote time for my own health for about say 6 weeks to 8 weeks. I postponed it till retirement. In 2007, I retired from service and came to Bangalore and stayed with my son. 2008 November, I had TURP done it, and that prostate size was almost 300 plus grams. So the doctor who did the surgery, he said it's a huge process, huge prostate, and I'm sorry I couldn't remove it fully. Almost 100 to 140 grams must be the residual, the remaining part, which hope it'll get shrink in the normal procedure. And after say medication for about 4 weeks to 8 weeks, I was normal. And of course, after the surgery, 32 days there was bleeding. Every urine passed, there were blood in the urine. And again, when I showed my anxiety, doctor said, no, it will stop after 3 to 4 weeks. And precisely after 4 weeks, it stopped. Then, with God's grace, 7-8 years, I had no problem. In 2016 beginning, again the bleeding started, and of course there were obstruction while passing urine. And this has been there since some time. I thought actually maybe the natural procedure, the flow was reducing over the period. Then we went to one of the major hospitals, Bangalore. After the detailed checkup, 2 lobes are coming and trying to enter into the bladder, and that should be removed immediately by surgical procedure. Immediately, I got admitted, and doctor did the done, and he said he has not done anything beyond it. Only he has just removed the obstructing parts. Then I came. 1 month again, it was bleeding in the blood in the urine, and after 1 month it stopped. Then continued till 2021. 2021 again this problem started, urine obstruction, and a number of times I had to get up at night, almost 4 to 5 times. Then we went to one of the major corporate hospitals on Bannerghatta Road, and there we met the head of the department, and he suggested again TURP. TURP was done for 2 days actually, and that was very, very tiresome and very exhaustive for me. Then, probably by a counter checking method, they had punctured in the belly to remove the urine in case required, when the normal urine tract is not holding it. This troubled me for at least 2 months, and all the sufferings, weakness, tiredness, and not able to take food properly. Again, this continued, and with normal medication. Of course, I am slightly diabetic, and little BP is also there. Medication goes on normal. Then in 2023 beginning, we were in Delhi. Delhi also we met the urologist after observing certain troubles. They give antibiotics and intravenous injections lasting for about 2 weeks. And during this time also, it was painful. Injection was very painful. Plus the trouble, and every day there was blood in the urine, and every time there was blood in the urine. It is not only the pain, even the mental agony when you see the blood increased, particularly maybe aging is a fact. Then we came back to Bangalore in March or April. Then April again we tried to meet doctors, and of course the head of the department was busy. So I met doctor, and Dr. Saab said, see, let us see. I think again you are due for a surgery, or let us see any other alternatives are there. Then he asked me, have you heard about prostate artery embolisation? I told him yes. Recently there was a YouTube small video. Basically, he was a cardiologist. He was talking about this, and he said over a period, after the blood supply to the prostate is stopped, prostate will start shrinking and this problem will not come up. And this I heard, this I listened. Then I talked to our family members. They said, is it an established treatment by the medical profession? That I said that we have to check up. I have no idea. We got it done on, I think if I am correct, May 23rd. And we got it done. And the procedure was, for about an hour and a half. Although it was scheduled for half an hour. And due to, maybe my personal conditions, it extended. And there was no problem. I came back. In the evening, both doctors came. They said there could be bleeding for about a week. After that, it will stop. Fortunately, I had only one time, that is after the procedure, say about 3-4 hours after the procedure, one time only a little blood appeared. Blood color. It was not even thick, it's like pinkish color rather. After that, there was next day itself. I talked to both the doctors, saying that absolutely there is no blood. Then he said, you can go next day. Fine. That very day, evening, we got cleared from the hospital. And I went back home. And it is more than a year now. There has been no problem with the urine or prostate, or the urine flow, or any pain or any disturbances. And conditions remains good. And I was asked to do a uroflow and ultrasound. Accordingly, it was done February end or March beginning. And it was perfectly alright. So doctor said nothing to worry. After 3 or 4 months, you may once again get it done, just to confirm. And then he said the prostate size has been reduced, and the PSA level also came down. One stage, it was almost 54 in 2016. So same way when we came for this procedure also, it was 16 or 17, and that has also come down drastically. He said yes, good improvement is there. Go ahead, normal living. Then I asked him, could I do my normal physical activity? He said absolutely no issue, you can do that. Walking, even yoga, pranayams, etc. You can do it. Whatever. And any convenient time, you can call on me. And I think after that, I had no opportunity to visit the urologist. And I think that's a good part. Thank you.